Imagine you're experiencing the worst mental health crisis of your life. So you do the right thing and seek help from a local hospital. And then all of a sudden you're told you can't leave. Your belongings are taken, you're told to change into a gown and escorted by security to a locked room. You're not sure when you'll get out or what will happen next. You're being psychiatrically hospitalized. During my psychiatry residency, I hospitalized dozens, if not hundreds of people this way. And I know that many times it absolutely saved people's lives. But also too often I felt that the process itself was too clinical, too sterile, too dehumanizing at times. And of course, potentially very frightening. So today I want to talk about what is involuntary psychiatric hospitalization, why we do it, and the messy, complicated reality behind it. For those of you new to the channel, welcome. I'm Dr. Robert, a board-certified psychiatrist. And on this channel, I really enjoy making educational videos on various mental health topics. And today I'll be discussing involuntary psychiatric hospitalization. And if you like today's video, definitely check out my prior videos, stick around for my future videos, like and subscribe, I really appreciate it. Okay, so let's start off just discussing what is involuntary psychiatric hospitalization. So it is what it sounds like. It's admitting someone to a psychiatric hospital against their will. And it can only be done if there is evidence that person is an immediate threat to themselves, others, or are very much unable to care for themselves in a safe way, all due to an underlying mental health condition. There's a very good reason that we have these kind of laws that allow this. Primary reason is to prevent death and harm in the community. I can recount dozens of times where this was very emergently needed, life-saving. I can think of times that people came in severe states of psychosis, a young woman running around naked in the middle of the night in a state of mania with psychotic features. Times that people with schizophrenia got aggressive with caretakers and needed stabilization. Many students, because we were near a university, coming in after suicide attempts, definitely requiring some hospitalization. So a lot of good reasons for these kind of rules that are very, very life-saving. But of course, as psychiatrists working in the hospitals, making these decisions, we also have to weigh some of the ethical risks of involuntary hospitalization. The main one is loss of autonomy, right? Because we're taking away someone's rights, someone's ability to choose what happens next by initiating a psychiatric hospitalization. And that's not something we take lightly. For some patients, that can be very traumatizing, right? Being told you can't leave, this is what you have to do, and then we'll see when you can get out. But the main thing that caused me, and I think many of my co-residents and many people who do this, always some hesitation, is not the decision to hospitalize or not, but the process of it. And during my training, the flaws in this process were really highlighted when a student who was hospitalized by our team had experienced a very negative and even potentially traumatizing experience from the whole process, and actually wrote about it in the school newspaper. And it was read by our department, and a lot of different feelings were elicited from that article. I won't get into the specifics of the article, but basically it recounted how one, just jarring and scary it was to show up to a hospital seeking help, and then all of a sudden just being told, well, okay, thanks for coming in, you can't leave. We're gonna have to keep you here for an indefinite period of time until we get a bed open in a psychiatric hospital, and then we'll send you over there. So that was very frightening. And of course, just being in the midst of a medical center, an emergency room, I think is not the most conducive place to anybody having a mental health crisis. It's very busy, it's very loud, it's very chaotic. Nursing staff is oftentimes very busy attending to patients who are potentially in life-threatening situations, from heart issues, lung issues, brain injuries, traumas coming in. Doctors are busy by that too. So someone coming in after a suicide attempt or in the state of mania, psychosis, might not get the kind of attention or just sort of therapeutic bedside manner that would be most useful, but that may be not fully available in that setting. I mean, the amount of times I had to interview someone in the middle of a busy emergency room hallway, literally screaming at the patient, "Did you leave a suicide note?" Because there's a code going on to my left. To my right, there's someone screaming in pain in the gurney. Like, it is ridiculous how busy it gets. And if the psych pod's filled up where we do psychiatric interviews, which are only 4 rooms, you're stuck in the hallways oftentimes doing these very, very intimate, very personal assessments on people. And definitely, I think that highlights that emergency departments, emergency rooms are not the ideal place, far from it, for any sort of mental health treatment. I get why they're the default, because there's nothing else in their place. Kind of like many police officers, it's not their job to be social workers, assist people during a mental health crisis, but because of the lack of other resources in the community, that's kind of what they're left doing. So I think the same issue kind of occurs in the emergency departments. For lack of a better place, that's where all mental health kind of conditions get siphoned into in an acute state. Yeah, that's the unfortunate reality behind it. In the midst of all that, you know, you have your phone taken away, your clothes taken away, you have to be in the hospital gown, you're constantly being observed, monitored. You might be surrounded by patients who are in very fragile states of mind, who may be acting very erratically, impulsively, even dangerously sometimes, and you're kind of stuck there and more frightened of that now than whatever brought you in. Then once you are admitted to the psychiatric hospital, there can be a lot of variation as to the quality of care you do actually receive. Certainly there are great hospitals out there, you know, nice bright lighting, open spaces, and as the hospital, even some outdoor space where you can also get attention from a therapist, go to multiple groups of group therapy a day, see a psychiatrist for, you know, more than just a couple minutes every day and actually get your mental health symptoms addressed. And unfortunately, there are places out there that I definitely know of where patients, especially underinsured and underserved communities, can get sent to, where, you know, you're just put into a room, kept there so long as your insurance pays. And all too often, people will get just loaded up on medications, antipsychotics, without much explanation as to what they'll be taking, what to expect, and then discharged as soon as financially feasible. You know, and all that being said, I've definitely had many patients, you know, my own experience of rotating on the psychiatry unit, which I really, really enjoyed. I love working inpatient. I don't do it anymore, but it was a very, you know, great highlight of my training experience. I really enjoyed working with severe mental illness in that very acute stage. And it would be great kind of having people come in. They're always very reluctant on the first day oftentimes, but by day 5, 7, they're thanking you, they're feeling much better, their families are thanking you, and they've made a complete 180 in their mental health, and that's very, very gratifying. That's also what leaves me very frustrated about the process, is that's not everybody's experience. So I definitely want to make clear, I am not against involuntary psychiatric hospitalization, because I've firsthand witnessed over and over again just how life-changing and life-saving it can be. So I more want to shed light on some of the structural issues and definitely validate people's experience of that if it is negative, and advocate for a more holistic, compassionate hospitalization process. And I think, you know, that'd be very difficult to achieve. I think having more well-funded psychiatric hospitals that have their own emergency department that you go to rather than the medical one, that can, you know, provide the kind of quality of care, compassionate care, with the resources on the unit, the social workers, therapists, the outpatient planning and all of that, that really helps people's mental health. But to be honest with you, I think that requires the kind of dedication to mental health and the kind of funding that society, government is not prepared to provide. But I do hope this video kind of helps people appreciate what the process is, what it's intended for, and some of the drawbacks that people can encounter in some situations. Because for anybody in the mental health crisis, going to a hospital, seeking that care, that is the best, most life-saving thing they can do. So if you found this video useful, informative, entertaining, definitely like and subscribe. Keep watching future videos. I really appreciate your support. I would certainly love to hear about your thoughts on this sometimes controversial topic of psychiatric hospitalization. As always, appreciate you watching, and I look forward to seeing everyone back next week.